So based on the different location and function of the adrenergic receptor, if you just try to connect their function and location, then you will get some ideas what type of drug can be taken and how it will work and where it will be used. Okay, so just try to connect the previous discussion and just uh, try to memorize the name of the drug. Okay, so now come to the point. First of all, this is alpha 1 agonist. So alpha 1 agonist, already I said alpha 1 is very much rich in your blood vessel throughout the body, in basically arterial and sphincter region. Okay, to regulate the blood flow, that will contract the blood vessel, already I discussed. So what will happen if you just take a drug that will make the contraction of the blood vessel, then you will get some benefit in a certain extent for certain region. That is, if you take phenylephrine, that phenylephrine can be used for your nasal congestion. You are suffering from nasal congestion, you can take, and that will contract your blood vessel within your nasal root, and it will help to remove from the nasal congestion. If you think, if you take this one in your eyes, then that will bind with the alpha 1 in your radial muscle of the iris, and that will make your eyes enlarged. That means people will be dilated. So you can use for your diagnosis purpose also. So that in that way you can use phenylephrine for your pupil dilation. Also, it can be used for cough. In some rectal preparation for blood vessel related problem, you can also use phenylephrine. Okay, so please try to understand the location and major function of the alpha 1. Already I said, if you in sympathetic pathway, alpha 1 is one of the prime modulator for sympathetic function. So it has major role for vasoconstriction. So in that way, that drug can be used. Okay. So now another agonist is your midodrine. That midodrine can be used for orthostatic hypotension. That means suddenly, abruptly, your blood pressure can fall down. Then you should take the midodrine, and that will increase the vasoconstriction, and instantly it will try to increase the blood pressure. Okay, so you will save from a sudden uh, accidental problem. Okay, so this is the midodrine. So midodrine and phenylephrine, these are the agonists of alpha 1 receptor. Okay, so this one is alpha 1. Now come to the alpha 1 antagonist. So you know the alpha 1 is just for your vasoconstriction, one of the major function. So what should you do if you are suffering from hypertension? Okay, you are in normal situation, your blood flow within your organ and system should be normal. You are not in a sympathetic mode, so no need to specifically contract the particular area to just increase the flow to the lungs or skeletal muscle. Not such type of situation, you are not in that situation, but you are suffering from hypertension. So what is the problem? So you know hypertension is basically 90% hypertension is you don't know the real cause. So that is primary hypertension. So what should you do at that time? If you just take a drug that will inhibit the contraction of the blood vessel, so that will normalize the, that means that will inhibit the contraction of the blood vessel. So peripheral resistance will decrease and blood flow will be normal. So you will get rid of hypertension. That means alpha 1 antagonist can be used for hypertension. Okay, so prazosin can be used for hypertension. Actually, prazosin is not a mainstream drug, not first line, second line antihypertensive drug. You know, ARB or ACI or calcium channel blocker or beta blocker or diuretics. Those drugs are usually used for the mainstream drug. But This drug is basically used for those who are suffering from hypertension resistance. That means combination drug is failed to treat them. So that can, in that case, you can use. Also, aged people and the drug, conventional drugs are not functioning, so you can use prazosin. Okay, or emergency situation you can use prazosin. So that is the antihypertensive drug. Another one is tamsulosin. So tamsulosin is also the alpha 1 antagonist, but this drug also can be used for hypertension, no doubt, because the same location, binding location is the same. So it can be used for hypertension, but it has another role. You know, alpha 1, already I said, alpha 1 is rich in your prostate gland. You know, the prostate gland, it is the male body urinary tract contain the prostate gland, and that prostate gland will regulate the blood urine flow. So in the prostate gland, when someone is suffering from benign prostate hyperplasia, that means prostate gland has been enlarged, so it will just hamper the urine flow. So what should you do? You can take the alpha 1 blocker, and that will facilitate to urinate. That means it will promote your urination. That means it will just remove the hindrance of your urination. So that can be a good choice for prostate gland enlargement people suffering, that means patient. Okay, so this is the special type of use of tamsulosin. Okay, now come to the another one, that is alpha 2 agonist. So alpha 2 agonist, already I said, alpha 2 agonist, alpha 2 is very much rich in your nerve ending. Okay, and that will regulate or control the adrenergic neurotransmitter. So if you just use agonist, and that will uh, inhibit the further release of adrenergic neurotransmitter. So the next neuron or next effector organ will be inhibited. So how, you know, the alpha 2 is basically, you know, the GI receptor. So inhibitory G protein is connected with the direct receptor, and those receptor will be on the ending of the nerve. So already I explained there. So when you will take the clonidine or methyl dopa, that will bind with the alpha 2 receptor, and that will inhibit the adrenaline cyclase. So ATP and your cyclic AMP or PK will not be produced enough, and those are very much important to activate the blood your neurotransmitter basically. Already I explained, so I will not go for details. So what can I say now? If you take clonidine, that will enter in your brain, that is your medulla oblongata, your cardiac center, vasomotor center, and that will bind with the alpha 2, and as it is the inhibitory neurotransmitter, so that will be a agonist. That means it will change the conformation of the receptor, and it will help the GI, that is inhibitory G protein, and that will help to inhibit the further neurotransmitter release. Again, methyl dopa. Methyl dopa is also the alpha 2 agonist, but it has dual role. Methyl dopa will enter into your nerve, and that will turn into alpha methyl noradrenaline. That is almost identical structure of noradrenaline. That means a false neurotransmitter that can be released from the nerve. Okay, but here alpha methyl noradrenaline also can bind with the alpha 2 receptor, and that can inhibit the further neurotransmitter release for the activation of adrenergic neuron. Okay, so those drugs can be used for hypertension, because when a nerve will be inhibited by its nature, and it will not release the adrenaline, then it will not increase your vasoconstriction or increase your heart rate. Okay, like that. So clonidine and methyl dopa can be a good choice for your hypertension. Basically, methyl dopa is for your pregnant mother. When a pregnant mother is suffering from hypertension, methyl dopa can be a good choice. Okay. Now, your alpha 2 antagonist. Actually, alpha 2 antagonist is not a mainstream conventional drug, is not usually used. So, eumbin, someone is suffering, male person suffering from erectile dysfunction, in a certain extent it can be used because mainstream drug is available for erectile dysfunction. So, it is not widely used drug, eumbin. Also, phentolamine. Phentolamine drugs is also like that, not the usual conventional drug. So soft tissue anesthesia for in combination with other drug, it can be used. Also, it can be used for when you withdraw the clonidine, that phentolamine can be used. In that way, it can be used in secondary level. So no need to focus more to eumbin or phentolamine. Now come to the beta 1. So beta 1 agonist. Beta 1 agonist is dobutamine. So you know the beta 1 is also the excitatory major receptor. Already I explained in the lecture. So when beta 1 will be just activated by a agonist like dobutamine, then it can be used for heart failure, because you know the beta 1 is very much rich in your heart, and it is present in SA node, AB node, and your cardiac muscle. Already I said. So what should you do? Your heart is going to fail. So instantly, if you take the dobutamine, then it can activate your heart. It can try to increase your force of contraction or heart rate or your other activity. So you can use for heart failure. Okay. So dobutamine is for heart failure. Now beta 1 antagonist. So already I said beta 1 is very much rich in your heart, also present in your kidney for renin secretion, that will activate the renin-angiotensin pathway. So that is also the factor for hypertension or your blood pressure elevation, and also in heart. So it will increase your heart rate, increase your force of contraction, as well as your um, uh, cardiac output, like that. So what should you do? If you just take antagonist of beta 1, then it will inhibit the heart receptor of beta 1 in your heart, as well as it will also inhibit the beta 1 in your kidney. So it will decrease the renin release, as well as it will inhibit the beta 1 of a heart, and it will just inhibit the force of contraction and heart rate. So if your heart rate is decreased, your blood pressure will decrease, your renin release will decrease, your angiotensin pathway will decrease, vasoconstriction as well as sodium water retention will decrease, blood pressure will decrease. So what is the summary? That is, beta 1 antagonist can be used for hypertension. That is a good choice for hypertension, but nowadays it is not the first line, second line drug. Already new, different, good alternative drug already available in the market. So it is one of the major area is for your hypertension and for your cardiac failure. You can use for your angina. You can use for your after bypass surgery. It can be your lifetime achievement. Also, if you think you are a patient taking angioplasty, so you can take that selective beta 1 selective antagonist. That can be nowadays bisoprolol is widely used for that. Okay, so now come to the last one, that is beta 2 agonist. Beta 2 agonist, already know beta 2 is very much rich in your lungs. Already I said, your skeletal muscle. So you are suffering from asthma, you are suffering from COPD, you are suffering from difficulty of breathing, that is bronchoconstrictile problem. So what should you do? You know the beta 2 is for your vasodilation of your lungs, that means airways or airway muscle. So if you take agonist, that will activate your beta 2 receptor within your lungs or respiratory tract, and that will dilate your That means it will causes bronchodilation as well as vasculature dilation of your lungs. That will increase your airflow or blood flow. So it will be helpful for your asthma as well as you can helpful for your COPD. Okay, so that would be the good choice for asthma patients. So that is salbutamol or terbutaline. Okay, now the last one is beta 2 antagonist. So beta 2 antagonist, actually specific beta 2 antagonist is not available. Non-selective beta 2 antagonists are there. That means some drugs can also inhibit the beta 1 as well as beta 2. Some drugs also inhibit beta 1, beta 2 and also alpha 1. Okay, so such type of drugs can inhibit the beta 2 but along with the other receptors. So that can be non-selective beta 2 blocker, or you can say non-selective beta 2 antagonist. So this is the propranolol that can inhibit alpha 1, beta 1, beta 2, and you can say carbidopa that can be inhibit beta 1, beta 2, or alpha 1. Okay, so you can say that beta blocker that can be called beta blocker, that can be called beta blocker, that can be called alpha blocker. Okay, so these are widely used drugs for anti-hypertension, COPD, or other drugs already, other factor already I explained. Okay, so this is all about the drugs associated with adrenergic receptor that can be agonist or antagonist. Okay, so thank you very much for watching my lectures.